Hi, you are watching this video because you or someone you love have some problem with your back or your neck. You found this website because of that problem. And I really want to get to the bottom of the 3 fatal mistakes most doctors make when it comes to helping people just like you with their back trouble. Mistake number 1 is this. Most doctors, most therapists, they assume that the pain is the problem. And in fact, most of the diagnoses reflect that, like ischialgia, lumbalgia, cervical syndrome, all these things. They're just pointing in at the pain as being the problem. But I know you're smarter than that. And I know you understand this because you've probably had this happen before. You get treated, the pain goes away, and then it comes back. Maybe it comes back a year or 2 later, maybe it comes back a couple of weeks later. But the reason for that is they're not treating the cause. They're suppressing the symptom. The symptom is the pain. The pain is your body's way of trying to tell you that something's not right. Please do something to look after me. Find out what's really going on so I can get help and get to working for you again rather than holding you back from the life you want to live. Please listen. So that's the first mistake, assuming that the pain is the real problem. It's not, it's an indicator. Agreed? Now let's move on to problem number 2. Problem number 2, and we all know this, classical treatment for back and neck pain is what? It's drugs. Now, you know, I'm all for being able to get comfortable when you're in acute pain and being able to sleep. But here's what most people won't consider. Every one of the drugs that you could possibly take for your back or your neck pain carry with them potentially deadly side effects. In fact, something as simple as Nurofen, not to pick on a brand name, okay, we can just call it ibuprofen or whatever the name of that drug is. I just came across research from 2016. That drug is responsible worldwide every day for thousands of heart attacks, fatal heart attacks. That drug and that class of drugs is responsible for kidney failure causing death, liver failure causing death. And it can happen from 1. It can happen from 2. The scary part is no one knows which one will do it and to who. So those drugs, even something as seemingly tame and safe as Nurofen, could be fatal or could end you up in a hospital. Now, the other thing is, a lot of the drugs that they use, those injectable cocktails they give for acute back and neck pain, they've never been approved for use for that problem. Did you know that? In fact, that mix of corticosteroids could actually worsen your problem so badly, it might be impossible to recover. Because those drugs, when they mix them together and they inject them into the joints, they cause accelerated damage to all of the things that are trying to hold your spine together. And muscle relaxants. Okay? What's one of the go-to drugs that a doctor will prescribe for you when your neck or your back is in a spasm? But here's what they won't tell you, because probably they don't even know. Those muscle relaxants, they're not relaxing your muscles. They're actually slowing down the output of the most important, most primitive part of your brain, which keeps you breathing, which keeps your temperature regulated, which keeps your blood pressure regulated. And they're actually slowing that down so much, it can sometimes become fatal. So the drug option, you know, do they work? Sometimes they do. They will help you get the edge off of that pain. But make no mistake, they carry a huge risk. A huge risk. Do you really want to leave behind your family and your friends and then wondering Was there something else that could have been done? And that brings me to fatal mistake number 3. Back surgeries and neck surgeries. In almost none of the cases that I have seen ever where patients had back surgery did they actually get better. In fact, it's being suggested that doing operation for back pain is bordering on malpractice because it doesn't work. The only time a patient should be subjected to an operation for their spine is if they've got hard neurological signs. What does that mean? If you cannot control your bladder or your bowels, you need an operation. So in other words, if you're peeing yourself and if you're pooping yourself and you can't control it, you need an operation. If that isn't happening, operation will guaranteed not help you in the long term. It's so common in the medical literature, they call it failed back surgery. It happens a lot, 70 to 95% of the time. And what happens is most of the time after the operation, we take somebody who had something that could have been fixed by going after the cause rather than treating the pain. We end up with somebody who becomes so disabled it makes their everyday life more difficult. Now, I hope I've convinced you that the classical way isn't necessarily the right way. Now, keep your eye on your email inbox. What you're going to see an opportunity to find a more logical way, a way that actually addresses the cause. So you could actually figure out in black and white, in the flesh, what is actually happening to you, what needs to be done to correct the problem, and how we do that. I've worked with thousands and thousands of people, getting them to overcome their problems by doing actual spinal correction, non-surgical spinal correction. Now, this video, I don't want it to get too long. I want to cut it off right here and right now, but I want to make you an offer. If you cannot wait to see the next video, you can pick up the phone, you can call me. The number is 01-550-9544. I will make sure that I see you today. Well, provided today is during my working days. So if you call me 01-550, doesn't matter how busy I am, how many people I have coming to me that day, I will see you and we will find a way to help you. Make sense? I'm here to help you to get over your pain, to infuse your body with energy you didn't think was possible, to improve your health status to a level that you didn't think was possible, to help you to look better than you ever believed was possible. All that can happen through the art and science of spinal correction. Thanks for watching. Looking forward to hearing from you, and more looking forward to seeing that smile on your face when you say, "Doc, thank you. I feel so much better." Thanks for watching. Keep an eye on your email inbox. You're going to see more information coming to you over the next few days. Take care. Dr. Anthony Deutscher and my lovely dog, Shelby. See ya.